Well, schools, sports teams, and employers are developing testing policies for people exposed to COVID-19 or those who show symptoms. In some cases, it's required to travel or even visit family in nursing facilities. KLTV 7's Luckie explains the 3 tests that are being used right now.
3 tests are used for COVID-19, and each one provides different information. For the basics, we went to the experts. KLTV 7 Med Team Doctor and Infectious Disease Specialist Dr. Ed Dominguez and Russell Hopkins, who leads Public Health Emergency Preparedness at Net Health. First, the PCR test.
That's the one with the highest degree of accuracy in determining if somebody has the virus.
It detects whether someone is currently infected by identifying the virus through DNA. A sample is collected through a nasal or throat swab, then tested.
The gold standard for being infectious, a danger to others, is the PCR.
There's also the antigen test. Again, a swab is taken in the nose or throat. But this test looks for certain proteins to detect an active infection. And a negative result doesn't rule out COVID-19. The state says antigen tests are less sensitive than PCR, so there may be false negatives.
That test is a good test, but it's not a great test. And if it's positive or if it's negative in the right setting, it still has to be backed up with the nasal test.
The third test looks for antibodies. This is usually a blood sample and only looks for infection in the past, even if there were no symptoms.
They tell us if somebody has been exposed, but it doesn't tell us when they were exposed, nor does it tell us whether they are actively infected right now.
The state says it's possible to test negative for antibodies if it's used too close to the beginning of an infection.
Are you looking to go back to work? Are you looking to change your behavior, cancel a trip? Those kind of things will then come into play on what test you should seek out.
All the tests can provide valuable results, but it's critical to understand the story each reveals. Luckie, KLTV 7 News.
And for a detailed look at the differences between COVID-19 tests, including what negative and positive test results mean, head to kltv.com, click on the big red box, and look for the link in